Fantastic. And so, as we're getting towards the end of our panel session today, a question for both of you. What is something in head and neck cancer that we need to give more attention to? Ari, I'll let you go first.
Yeah, I think I'll just take a theme that I think is important that we didn't really discuss today, which is long-term functional outcomes, quality of life, survivorship. Patients that get head and neck cancer really suffer from the fact that this is cancer growing in an area of high value real estate, where we speak and swallow and communicate and have, is visible right to the outside world. And there's cosmetic implications to all this. And as much as we are excited about some of these treatments, I hope that incorporating some of these new treatments can also improve long-term function, long-term quality of life, fewer late side effects, late toxicities that affect those things in patients that are long-term survivors in terms of organ preservation, speech, swallowing, function. So I'm thinking not only about cure and survival and some of those themes that we talked a lot about during this discussion, but also have in mind the patient and their function, their quality of life.
Yeah, thanks for that thoughtful response. And John, how about you?
Yeah, I think it's interesting. A lot of what we've talked about today has really been focused largely on HPV negative patients. So patients who traditionally had the traditional head and neck cancer, smoking and drinking. And I think so many of the exciting agents, some of the ADCs, cross and could be effective on both, but a lot of the most exciting data and the most exciting treatments in this space are not for the HPV positive patients. And it's crazy to imagine, but if it continues this trend, I could see the survival flipping, and traditional HPV positive patients with recurrent metastatic disease live longer. But unless they get some really path-breaking treatments, it almost seems like the HPV negative folks might enjoy greater survival. So I'm hoping that and there are some, certainly some treatments that looking at kind of the viral signature, treating that to improve immune therapy. So there's some excitement there. But I think we honestly need more in the HPV positive space to really change the game. So I'm hoping we can make some progress there in the coming years.
Great. And so, my last question for today is in one sentence or less, what are you most excited about as we start thinking about 2026? John, I'll let you go first.
Yeah, well, let's see. Most excited about in 2026. I think with the theme of this perioperative treatment and really one integrating the current standard of care, because as we alluded to, it's not the easiest thing. The requirement of the PDL1 for the approval, there's a lot of work there. But I think really exploring novel treatments pre-surgery or as Dr. Rosenberg said, pre-radiotherapy, chemoradiotherapy to potentially improve overall survival, have less morbid treatments, whether it be radiotherapy based or surgery based. But I think there's a ton of excitement in what we can do with this platform having a foothold now with pembrolizumab.
And Ari, how about you?
Yeah, I'm excited in 2026 that hopefully we'll start seeing some of the, readouts from some of these phase 3 trials that are ongoing, exploring some of these novel therapies that have looked quite promising. I think we mentioned a number of them, the antibody drug conjugates, the EGFR bispecific antibodies, some of the HPV specific therapies. And so I'm looking forward to some of those reporting out and for us to see those results again with the aim of advancing the field forward and improving outcomes for patients with head and neck cancer.
And I'll take a bite too. I think we talk about therapeutic advancements, but also we need to think about selecting the right patients to get the right treatments, and that's where biomarkers come in. And so I am really excited about the potential use of circulating tumor DNA and how we select patients and we monitor their response to treatment and look at for recurrence and hoping that we'll have more data and studies that can look in this space further. And so with that, we've come to the end of today's roundtable discussion. I want to thank our fantastic panelists, Dr. Kazmar and Dr. Rosenberg, for this excellent conversation. Thank you to Cancer Grace for allowing us to join.